Good afternoon, ladies and gentlemen. Thank you very much for getting me here to share with you my story. I will talk with you the stroke burden in Vietnam and protest of stroke care in Vietnam with NGO activities. And last week, I can tell you about, I share you about the data of registry of stroke care for the last year, 2018. First of all, I want to share you a few slides about stroke burden in Vietnam right now. In Vietnam, we have about 96 million people, and we have 63 provinces. And you can see here, 2016, the GDP of Vietnam is reached about more than 200 billion. And the government pay for medical service about 6%, and that means $126 per person per year. So if you can see the burden of a stroke, the last 30 years, in 1990, stroke is the second top below the lower respiratory infections. But recently, from 2010, stroke in the top is far higher than road injury is the most important cause the death in Vietnam right now. And this data is published from Ministry of Health. You can see the stroke is the top of cause of the death in Vietnam. Even male is with 18%, and female is 23%. And how about progress of stroke care in Vietnam with NGO? Before 2006, we still keep the stroke patient together with neurology department. And 2006 is the very important year because it's the first time we separate the stroke unit to generally a neurology team. So right now in my center, I have about 140 stroke beds with 16 neurologists and 52 nurses and 5 physical therapists. And you see here is my center is the south of Vietnam. It's based on the MOH. They say they estimate about 200,000 new stroke per year in Vietnam right now. But you can see it's the data from only my center. It's only one hospital. If 2006. This is the first time we organized the stroke unit. We have about 1,300 patients, and the last year we nearly get 12,000 stroke patients. And from 5 months in 2019, we got more than 6,000 stroke patients coming in my center only. How Hospital? If you come to Ho Chi Minh City as well as the big center city in Vietnam, you can see very, very bad traffic, a lot of motorbike. So that's why it's based on databases. More than 90% of our stroke patients arrive hospital via public transportation. It's not by paramedic, because if they wait for a paramedic, they still wait alone. So how about the motorbike unit? This may be possible in Vietnam because I can assure of you, 100% of Vietnamese can be actors on the street. The skill for motorbike very good. They can bring the stroke patient come to hospital as soon as possible. If you can see the IV thrombolysis rate in my center, it's the first 10 years, we reached about approximately 3% of our stroke patients, and the door to need the time about 57 minutes. It's the first time we worked with NGO in March 2017. We organized a lot of meetings to train how to deal with stroke, and we train for not only nurse, but also is stroke neurologist. And we also to organize a lot of stimulation to train how to treat the stroke, and organize public talks for communities, for all of the community to recognize stroke symptoms and come to the hospital as soon as possible. And the key change of stroke care in Vietnam is we localize the stroke protocol and checklist. And we asked for all of center in Vietnam to deliver TBA at a city table and using the stroke bed. And we provide for stroke center in Vietnam point of care testing to reduce the door to needle time. And we also, they asked them to chance the rare quality monitoring, look like a rescue program. And for EMS, we train them how to recognize the stroke symptom as soon as possible and how to deal with stroke. And we provide them the stroke map that show them what is where is the best hospital. They can bring the patient come and receive the IV thrombolysis or thrombectomy. We also standardize the protocol for nurse, and especially we send them the message how to we put the target, how the door to CT scan should be lower than 25 minutes. And we also provide for all the protocol for physician, how to deal with TBA, how to deal with a stroke patient, and we send a message very strong. It's time is friend. If we reduce the time window, we can reduce the disability and mortality. And we also provide the stroke center around the country, a stroke bed, and we ask them let's treat the TBA in the city room. And the last day I can share with you the data is the last year. It's data from my hospital only in 2018. It's, we include more than 8,000 stroke patients in last year. And more than 99%, we keep the patient in stroke unit. 1% is the very severe intracranial hemorrhage, and we have to put them go to the ICU. How about stroke type? More than 80% is ischemic stroke, and 20% is hemorrhage. And gender is a little bit higher in male, more than female. And the NIST median score about 7. That means most of them is mild or moderate stroke. And very important, evaluate the symptom to onset to hospital arrival. As you can see here, in 2018, we have about nearly 20% of our stroke patients arrive to hospital within 4.5 hours. That's very important because we look for the last data. The last few years, only 8% can arrive to my hospital only within 4.5 hours. Why? Because my hospital not treat in the local, my city is more than 50% of our patients is way outside in rural areas. It's far away from hospital. So 20% is very significant number. And the CT scan and MRI we did for all of nearly 99% of our patients because it's 1% is maybe from other hospital transfer to my hospital, and most of them we finished the CT scan and MRI within 1 hour after the patient admission. How about regeneration treatment? You can see here we last year we got about more than 6%. We got more than 11% with any regeneration treatment, 6% with IVTBA only, nearly 4% we combine IVTBA and thrombectomy, and 1% is thrombectomy only. And you can see here is the number we treat with IVTBA. This the first year we do the TBA, which only 9 cases goes up, but before Angel Initiative 2016, we have only 264. But after Angel Initiative, we standardize the protocol and minimize the door to needle time, and now to go up to more than 500 stroke patients in 2017. And the last year, we got nearly 1,000 IV thrombolysis cases. How about thrombectomy? It's the same story from Angel Initiative. Before that, we have only more than 200 cases which we do with thrombectomy. And 2017, we got more than 300. And last year, we have more than 400 cases we do with thrombectomy. And so before Angel, from 2016, we got around 3% of patients got the TBA, IVTBA, but from 2017, we got it's double. It's more than 6%. And the last year, we got 10%. It's a very significant number. And the door-to-needle time is better, much better. We allow 44 minutes compared with the last door-to-needle time, 57. But the door-to-ground time is a little bit high. It's 131. Why? I show you. Because when the patient admission, and we take about 10 to 15 minutes for got the first CT scan, and then emergency doctor refer to neurology to explain, to get the consent form and prepare for the third. And then the door-to-needle time is 44, but the time for door-to-needle to be transferred to cath lab and do the cron is more than 80%, more than 85 minutes. Because why? Because right now the insurance in Vietnam pay 100% for IV-TBA, but only 50% for thrombectomy. For thrombectomy, the price is now in Vietnam about $4,000 US. That means the patient have to prepare half by $2,000 US. So that's some doctor have to wait the patient bring the money to prepare, at least have some money to prepare for to thrombectomy. That's why the time for door-to-ground time is a little bit delayed. And one more thing please. One more thing is the time for CTA is also take about 40 to 45 minutes. And AF, about 60, nearly 80, 70% is with anticoagulation after discharge. Antithrombotic is 94%. And 40 with the median hospital stay about 4 days. And most of patients we discharge directly to home because we don't have enough rehabilitation center. And very important, we got the word from US last year. And now is the number of stroke units now is go up from 40 to 60. It's not only a big city, but also around the country. And we hope we can get 100 in 2020. For conclusion, the stroke care in Vietnam is significantly improved since joining Angel Initiative. And the rescue registry is ongoing and will continue to collect the data and more centers around the countries. And recently we have 3 centers got the gold standard from ESO. And the result of the rescue will reflect the real scale of stroke care in Vietnam right now. Thank you for attention.